Hey there, my dear friends, and welcome back. It's been a little while since I've done an explaining through ASMR video, but I do really value this series, as I think teaching is very important. It's part of being a social animal in our species to help and teach each other. And I think the act of teaching is also a great way to solidify your knowledge. And thus, I thought a little bit on the spur of the moment that I would film a video about a topic which I can talk about without any notes. Today, I'm going to be talking about lymphedema, because I think that the explanation of this disease allows for an interesting enough introduction into the immune system and the lymphatic system, both of which, of course, are very interesting topics on their own. But I thought I would have a bit of a ramble. Usually these videos are structured fairly tightly, but I thought that it might be a change since there's been a lot going on, and it might be nice for me to do something a little bit more casual. Now, let's start with an understanding of what lymphedema is in a practical sense. Lymphedema is a disease where you have a limb or a part of your body that is swollen, that is full of lymph, that can make it heavier, larger in volume, have aesthetic differences, and also provides unique health challenges to the individual. I think this is a good topic to introduce you to the lymphatic system. So, you'll undoubtedly know of the circulatory system, which is a system that you have of vessels, veins, and arteries, little tubes throughout your body that transport cells, e.g. red blood cells, to deliver nutrients and take away waste. And that's that system, but you also have another system which plays a quite important role in your body, called the lymphatic system. And similar to blood, this has a system of tubes which, instead of connecting in the way that blood vessels do, connect in their own various ways to things called lymph nodes. And these are kind of, little balls or clusters of balls that hold in important immune cells and material. And you can find these around here on your collarbone, on the underside of your neck, armpits, chest. Your tonsils might be included in this. And the purpose of this system, largely, is to provide you a solid defense against infection. When you have a sort of infection, something like that, it can sit in the interstitial fluid, which is a sort of fluid throughout your body, and that fluid then gets drained into your lymphatic system. And then, somewhere along the line, the infection gets taken to a node, and that is where the kind of more organized battle happens, aside from the battle at the site. So that's, when you get sick, or if you have a really bad infection, such as, a really severe nose or ear infection, why you might start feeling swelling lumps, on your glands, across your body, because something is going down. And so, this is all well and good. Of course, this system has other functions as well, but I think maybe we can leave that for another video. With lymphedema, for some reason or other, your body tends to transport and collect lymph to an area. I think most typically it's a limb, so it can be, at the hand, wrist kind of area. You can get an arm that's, multiple kilograms heavier than the other. And in the legs, you could have swollen ankles, swollen feet, all depending on the severity of the condition and your treatment. I had some brief experience on a lymphedema ward when I was studying occupational therapy, which gave me a good introduction to an understanding of the condition. And, of course, anytime people are in pain or uncomfortable, it's not pleasant, but in its only unique way, this condition is, of course, interesting. One common way that I've seen this condition manifest is post-radiotherapy or post-surgery to a lymph node. So it can be kind of common for people with breast cancer to get surgery and then have a lymph swelling problem. There are lots of different ways that we go about treating this. Occupational therapists are employed as specialists to help with the treatment of this condition. If you know someone who has lymphedema or lymph swelling and they're not doing their occupational homework, I really would suggest to you to try and get in there and see if you can make them go do their homework, because a lot of this stuff really helps. So for treatment, one of the things that we do is a sort of almost figure 8 massage method to help the fluid keep moving and draining. So people kind of do a massage motion and they bring it up from their arms or legs kind of into their body to help it spread out. Another thing that we do is give compression clothing. It's very common that we will give, compression stockings or sleeves or gloves, which would be quite tight to stop the lymph coming in and to keep the area at a relatively normal or unaffected size. You can really see how much pressure clothing and pressure does when you examine someone who has not got to the point in lymphedema where they can't wear shoes, but is verging on that point. So a lot of people will keep their shoes on, all day, and their ankles will get really thick, full of lymph. But then when they take their shoe off, their foot is a relatively unaffected size, dramatically smaller than the ankle. Whereas if you assessed someone that was not in the habit of wearing shoes, their feet really can swell up quite significantly. And this can be quite dangerous for a number of reasons. I'll go into the dangers now. One of the prime dangers is infection. And it can cause a disease which for some can be deadly, called cellulitis, which awkwardly and quite annoyingly has the same name as another skin condition. But no, it's not the aesthetic skin condition of cellulitis. It's actually a type of infection, which can be life-threatening. The risk of infection here is increased for a variable amount of reasons, but one of them is lymph, if it goes to the surface of your skin, can quite easily attract this infection because of the extra proteins that it contains. And that's one of the reasons why therapists really tell their patients to habitually moisturize their locations of lymph buildup very frequently. Because if you're prone to dry skin, the increased surface area from the lymph swelling and, of course, any pressure, anything like that, can really increase the chances of your skin breaking and causing a small infection. So a lot of our treatments are around avoiding getting an infection. One of the other prime things that occupational therapists do, or physiotherapists, whatever allied health professional is assisting, is that we use a machine which actually squeezes the lymph, interestingly. It's kind of like when you get something to check your blood pressure. You get these kind of really long socks or something to put your arm in, and then it'll squeeze here, and then up here, and then up here, and it doesn't squeeze the whole thing on or off. It squeezes in a motion which actually, interestingly enough, brings up the lymph out of the areas where we don't want it to be. Some people get it once a week. Some people get it once every 2 weeks. Some people are advised to buy it and take it home with them and use it very frequently, or as frequently as possible, based on the severity of the condition and, of course, their own personal situation. Another one, of course, you've probably heard this, is if you have something with swelling, you want to get assistance from gravity. So you might want to, keep your arm elevated as much as you can, or your leg, so that the lymph can drain out. Now, I don't really know why I chose to talk about lymphedema. There are many things to talk about, but I was sitting down and it randomly struck me that I think lymphedema is quite an interesting condition in 2020 with COVID, because I think there probably are a lot of people who should be reminded that it's time to start taking care of yourself. There are lots of people who probably are avoiding their treatment sessions, and so if any of you out there know someone, or you yourself has a lymph build-up, remember to take care of yourself. Another important thing, of course, in the management of almost all illnesses, is remembering to do safe, regular exercise. And I think that when people are at home, some people, interestingly enough, have been doing a lot more exercise, like walking their dog, and some other people have been doing a lot less because they have less of an access to gyms. But I would like to encourage you to keep up your health. Now, lymphedema is actually not akin to all lymph swelling. There are other conditions or situations where a lymphatic swelling can occur, a lymph buildup can occur. lymphedema in itself is usually a chronic issue, but you can have a temporary lymph buildup for other reasons, such as surgery. If you have knee surgery, it's super common to have swelling, just as it is common to have swelling in any surgery. And the advice there is relatively similar, though remember that if you've recently had surgery, it's probably not wise for you to ignore instructions and go out doing advanced exercise. Do what is prescribed to you and recommended by your health professional. As I am not a qualified health professional, nor am I your qualified health professional. One of the interesting things that doing brief placement in a lymphedema ward and a chronic pain and hand therapy ward has shown me is actually some people's reluctance to wear the proper equipment, to wear their assistive equipment such as pressure, stockings or splints. It's because simply the visual aesthetic, which is very interesting because a lot of these things are really, really effective. All of them have good clinical evidence. And as occupational therapists, this is actually an area that we try to learn about and prioritize when we study. So in one of my classes, we actually learnt about examples of people pushing away from using splints and stuff like that because it's not the right colour. And so we tried to specialize in learning about the individual and their own aesthetic preferences. And I think a lot of people, when they go and get a splint, when they go and get some sort of garment from a allied health professional, don't exactly know this aspect. But when you have a hand therapist who is qualified, and when they're trying to make you a cast, they're actually trying to make it very aesthetically pleasing. If you watch them, they try to avoid putting any fingerprints on your splint. They try to round the edges not only to protect you, but also for increased aesthetics. Some places and some people, of course, don't try as hard as others, but it is actually written in many textbooks and in much scientific literature that it is best practice to try and get something which aesthetically fits your patient and which pleases them, as they are much more likely to comply. And that's one of the things that I found really interesting when going into this, as opposed to looking at the health sector from without. When you're in, you really realize that the study of health is really, really trying as much as possible to be all-encompassing as it can be, and trying to think about as many different variables as it can. And that's one of the reasons why I think some people are surprised when a health professional can talk about something that they assumed that the health professional would not have considered. Because the amount of work that health professionals put in, the amount of learning that they do and dedicate to, and the amount of practicality within the systems is really high. And it's probably only really at a level at which you could properly appreciate if you yourself had studied it, either, at a university or done some really in-depth study at home. I find it interesting seeing the small things like the psychology of the colour of a splint or the colour of a garment, the fashionability of wearing white gloves in summer to keep the lymph out of your hands. Stuff like that is all very interesting. And so, when you're going to do something, if you're a health professional watching, or if you're any other person watching and you're making something for someone, remember to keep in mind the human factor. I guess that's what this ramble amounts to, is that when treating an individual, learn about the disease, learn about their condition and their personality and their person, and remember them as a prime variable. I hope you liked this random, rambling lecture. As I said, I didn't plan it out. I just started talking about what was in the back of my mind recently. But I hope you liked it, and I hope that maybe this has helped you have a break, a pause, a reprieve from your worries or the stresses of the day. And I hope that you sleep, rest, or continue on in as appropriately as a manner as you can. Good night.